Letters of recommendations. Extremely important for any candidate, regardless of a specialty, for matching and to get the maximum number of interviews. In this video, I will share with you top 6 tips that you must remember before obtaining the letter of recommendations. My name is Dr. Farzana Hoque. I'm an assistant professor of medicine, currently practicing in the US. Over the last many years, when I review the application for interviewing the candidates, one of the most common thing I emphasize in their ERAS application, that is letters of recommendations. Because your letters of recommendations is giving the message to the interviewer that how you are as a person, as a residency candidate, how the renowned physicians, the physicians who worked with you is evaluating you, and they are getting kind of overall judgment from their letter of recommendations. So which things you can do to get great letter of recommendations to increase your chance for matching? Number 1 tips, extremely important. Always request your letter of recommendations early. If you can try to find out the letter writer and ask for letter of recommendations before 2 to 3 months, that's always ideal. However, please give your letter writers at least 1 month to get a great letter of recommendations, because physicians practicing in the North America is facing a lot of workload and everybody is running after time. So please give them enough time. It will ultimately benefit you and you will get great letter of recommendations. Secondly, when you are asking for your letter of recommendations, give your CV. Because if you are giving your CV, they will be able to review it and they will be able to highlight which points in your CV they found promising and be useful, that will draw the program directors, program coordinator, and ultimately the interviewer attention. One of the important points to remember here, that when you are giving this CV, keep it between 2 to 3 pages. Do not go more than 3 pages. The third tip will be, when you are giving the CV to your letter writer, always include your professional picture, not a picture that could be your Facebook profile picture. I'm talking about professional picture, because when your CV will have your professional picture, the letter writer will be able to see that and it will be able to build a emotional professional bond with your letter writer, and ultimately when it will come to your matching season, your interview season, that will work in your favor, and that letter writer could be a source to get an interview for you. So number 1 tips is request early. Second, give your CV, keep it between 2 to 3 pages. And thirdly, add professional picture in your CV. Now the number 4 point will be important to remember, is that it's always better. It goes in your favor. It put more weight in your letter when you waive your right to see the letter. So you should trust your letter writer that he or she will give you an excellent letter. So you should waive your right to see the letter. Number 5th point will be, always ask for updated letters. For example, if you are a repeat candidate this year and you have a letter of recommendation that you got from last year and you want to use it, it's okay. However, tell your letter writer to change the date so that the letter is up to date. Even if they are not changing anything, request them to change the date, because in this way, the program will get the up-to-date letter. The number 6 point will be, always try your level best to get the letter of recommendations from physicians who are working in the US. The back home physicians, for example, if you are from India, Pakistan, Bangladesh, or any other countries, you may think to get the letter of recommendations from physicians who are practicing there. I will highly recommend you to give the letter of recommendations from the physicians to whom you maybe did externship, observership, or research in the US. Because you are applying to US, and the program director, when they're reviewing your application, as they know and they have overview of idea that, okay, where this physician could be working, the specialty. So it's always for your best interest to give the letter from physicians who are working in the US. However, I understand if you do not have any letter, and for some programs you need to give 4 letters, so it would be okay to give 1 letter from your back home physicians whom you maybe worked in your medical school or after your medical school. Your target should be giving all 4 letters from the physicians practicing in the US. Now, I will give you a bonus tip, and that is, have a good balance of letter of recommendation from clinical faculty and research faculty. For example, if you are applying for residency in a community hospital, if you give 3 or 4 letters that you got during your research experience, that will not look good in your application, because in community hospital, they are mainly clinical focused. You maybe do some research, however, their main focus is clinical area. So keep in mind that which program you are applying. If you are applying to a community program, have a good balance of letter of recommendations from clinical and research faculty. On the other hand, if you are applying to a university program where they have a lot of research, you can have 50-50 percentage of clinical and research letters. However, I would not recommend you to give 100% research letter, because remember, when you are intern, regardless of any university program, doesn't matter how good or how they have reputation in research area, you are focusing your year in clinical area. So have good balance of both clinical and research faculty letter of recommendations. I hope you will find these tips helpful. If you have any questions or any comments, or you want me to make video on any specific topics, please put it in the comments below. Please like this video, share this video with your friends whom will be benefited from its content. Please subscribe to this channel. And I will see you in the next video. Until then, I wish you all the best for your residency application year.